Come in.
Hi, good afternoon. How are
Hi.
you?
I'm good.
My name's Lindsay Kozicz. I'm the physician assistant that will be taking care of you today.
Hi, Lindsay.
Very
Nice to meet you.
What's your name?
My name is Moini.
Hi, Moini.
Hi.
So nice outside today.
Yeah, it is.
Yeah, it's been a big start to the week with the holiday. Did you do anything fun?
Not really. I went to Santa Monica, had dinner with a friend. That was about
nice.
it. Yeah.
Nice.
And saw a really cool show, The Bag Lady. Have you heard of it?
I haven't. I've actually I've never heard of it before. Where was it?
It was in Hollywood.
Okay.
Yeah.
And it was good?
It was.
You
It was very
recommend
good. I do,
Okay.
for sure. Yeah.
So I hope that it's okay. I'm just going to be taking a few notes today while we chat, just to remind myself after our visit of what you told me today. Is that okay with you?
That's fine.
Okay. Are you comfortable?
I am very comfortable.
So what brings you in today?
I've been losing a little bit of weight.
Okay. How much weight would you say?
About probably like 15, 20 pounds.
Okay. And over what time period?
It started about 3 months ago.
And has it been gradual, or have you lost weight more in the beginning or more in the end?
It's kind of picked up over the last probably 3-4 weeks.
Okay.
Yeah.
And how much weight have you lost in the last week?
Probably about half of that.
Okay. All right. Any other symptoms?
My stool's a little bit loose.
Okay. When you say a little bit loose, do you mean complete water or soft?
Complete water,
Okay. And how many times a day is that happening?
like multiple times a day, like
If
10,
you could-
10 times a day.
10 times.
Sorry, this is embarrassing.
It's okay. It's okay. That's why you're here, for us to get to the bottom of this. So you've been having watery stools about 10 times a day.
Yeah.
How much are you going each time? Just a little bit?
A lot. Like it fills the toilet every time.
Okay.
Yeah.
And is the stool brown, black, bloody?
It's like watery.
Okay.
Like pretty like light brown.
Okay.
No blood that I've noticed.
Is it painful when you go to the bathroom?
No, I really don't have much pain.
Okay.
Yeah.
Any nausea?
Nope.
Okay. All right. Anything else that you've noticed at all out of the ordinary?
No, I don't think so.
Okay. And these episodes of diarrhea and weight loss has never been accompanied by pain?
No.
Okay.
No.
No pain after eating?
Well, I mean, I do notice that eating makes me have the diarrhea.
Okay. So would you say that when you eat, every time after you eat, you have to go to the bathroom right
Yes.
away? Okay. And is there specific foods that are making you worse?
Interesting that you asked that question. I have noticed that pasta and bread, sometimes dairy even,
Okay. And do you notice that when you eliminate those things that it's better?
much better.
Okay. But it has not gone away?
No, because I still eat those things because I like them.
Oh, okay. Okay. Have you been under any stress lately in your life?
I mean, other than having diarrhea, no.
Okay. And is it limiting your ability to complete what you would say a normal day, working or whatever you like to do?
Well, I haven't worked for the last 3 days because of it.
Okay. So it's significantly impairing
Yeah.
your ability to live your normal life.
I would say
Sorry
yes.
to hear that. Hope that will be able to help you out here. Has anything like this ever happened to you before?
I mean, not really. When I was little, they told me I had some stomach thing, but that's
Nothing
when I
that
was
you
like
really
6.
remember?
Yeah.
And anyone else in your family experience these symptoms?
I mean, I know my mom, I remember my mom saying that she always had really bad diarrhea and she had to not eat certain things, but I don't remember what.
Okay. All right. Has anything you've done helped your symptoms at all? Or made them better?
Other than just avoiding those foods, no.
Okay. And other than those things, anything that you noticed making it worse?
No.
Okay. And have you taken any medication to help with any of your symptoms?
I take medications, but not for that.
Okay. What medications are you on?
I take something that's supposed to make my stool soft.
Okay.
Because I used to be constipated, and that got prescribed to me.
Okay. How long have you been taking that?
Probably 6 months.
And have you continued taking that despite the diarrhea?
Yes.
Okay.
Should I not have?
Well, it may be contributing.
Okay.
So I probably would stop taking
Okay.
that.
Okay.
Any other medications?
I take birth control.
Do you know what the name of it is?
I believe it's Elise.
Okay. Any allergies?
To what?
Medications or foods?
I'm allergic to Z-Pack.
Okay. And what happens when you take a Z-Pack?
Makes my stomach sick.
Okay. Any rash, trouble breathing?
From the Z-Pack or otherwise?
From the Z-Pack?
No.
Okay. And are you taking any over-the-counter medications?
I do use a little bit of hydrocortisone cream.
Okay. And where do you use that?
My elbows, I have like this weird rash on my elbows.
Oh, okay. How long has that been going on?
Like the last 2-3 weeks.
Okay. And have
See?
you ever had that before? Oh, yeah. Have you ever had that before?
No.
Okay. Is that rash itchy?
Pretty itchy.
And other than the hydrocortisone, you haven't been using anything on that?
No.
Would you say the hydrocortisone is helping?
A little bit, not really.
Okay. No rash anywhere else on your body?
No, but look how terrible this looks.
Yeah. Okay. All right. Any other past medical problems that you have?
What do you mean?
Any other medical problems that you've been diagnosed with throughout your life?
I don't think so.
Okay. No depression, anxiety,
No.
high blood pressure,
Nope.
diabetes?
Nope.
Okay. No illnesses in your childhood that you can remember that were significant that you were hospitalized for?
Nope.
Okay. Any surgeries that you've had in the past?
I think I had knee surgery when I was younger for problems with my ACL.
Okay. All right. And that's not been a problem since?
Nope.
Okay. Do you know when that was?
I think I was like maybe 12 or 13.
Okay. So in like 1960?
What are you implying?
Just kidding. Okay, so who do you live with?
Myself and my dog.
Okay. And what do you do for a living?
Actually, I work on the Nabisco taste test panel.
Okay. And what are you tasting?
Crackers, cookies.
Oh, I see why it's been
Bars.
limiting your ability to go to
Yeah.
work. It seems like those are products that really are containing like dairy and wheat. So that seems like it's exacerbating your problem, huh?
Why? Does wheat have something to do with something?
Well, no, you had just mentioned that food like pasta and
Oh.
bread really made your symptoms worse. So it seems like those
Yeah.
crackers and bars and cookies and things like that.
They
maybe-
do. It makes it much,
maybe
much
making it
worse.
worse.
Mm-hmm.
Okay. Okay. Do you drink at all?
Sometimes maybe I'll have one drink on the weekend, but rarely,
So total number of drinks a week, you would say one?
if even.
Okay. And what do you drink? When do you do drink?
A beer.
Okay. So one beer per week.
Yep.
Okay. Do you smoke
Or less.
cigarettes?
Nope.
Any illicit drugs, marijuana, cocaine,
No.
PCP,
No.
heroin?
No.
No. Okay. Never.
No.
Okay. Are you sexually active?
I am.
Okay. With one partner or multiple?
One.
Okay. And do you guys use protection?
We do.
Okay. And you said that you're on birth control. So it sounds
Correct.
like you're- okay. All right. Other than avoiding the dairy and the pasta products, do you do any other dietary modifications to your normal diet?
I mean, I try to eat really high fiber foods.
Okay. And what would you say that includes?
Lots of fruits and vegetables.
Okay. Do you eat meat?
I do.
Okay. How many meals a day do you have?
Like 4 or 5.
Okay. And the weight loss that you've been mentioning, was that intentional or unintentional?
No, I didn't want to lose the weight.
Okay. All right. How about physical
I
activity?
mean, I'm practically a twig now. Yeah, I exercise daily.
Okay. And would you say that your exercise is mild, moderate, vigorous?
Pretty vigorous.
Okay. And for how long each day?
2 hours.
Okay. What kind of exercise do you do?
Just lifting and different types of endurance training.
Okay. Okay. We talked a little bit about your family history, and you had mentioned that no one in your family has had experienced symptoms like this. Is that correct?
I said my mom
Your
had
mom.
actually.
Okay. And what were has she been diagnosed with any specific
No.
condition or?
No, she just had diarrhea and avoided some types of foods. I don't know what.
Okay. And that has seemed to take care of her problem.
She just avoids certain foods.
Okay.
Yep.
All right. Any other medical history in your family? Any other medical problems?
I think my brother might have autism,
Okay.
and I think my father may be diagnosed with hypertension, but I'm not sure.
Okay, I'm just going to list through several medical conditions that I find pertinent. If you could just tell me if you know whether or not anyone in your immediate family has that.
Okay.
So that includes your mother, your father, your siblings.
I don't
and-
have any siblings.
Okay. I thought you said your brother has autism.
Oh, other than my brother. Is that what a sibling is?
Yes.
Okay.
Okay. So high blood pressure, you said your father.
Yep.
Anyone else?
Nope.
Okay. High cholesterol?
Nope.
Colon cancer?
Nope.
Any cancer?
Nope.
Diabetes?
Nope.
Okay. Heart disease?
Nope.
Okay. Okay. So let me just summarize what you've told me, and then we'll go through and see if there's anything that I missed or anything else that you want to add.
Okay.
How old are you, by the way?
24.
24. Okay. So for the last 3 months, you've lost between 15 and 20 pounds, and it seems like it has accelerated and gotten worse recently. You have been having diarrhea, watery stools in large amounts, about 10 times a day, and it has been significantly affecting your ability to live your life normally. You have missed work for the last 3 days. Foods that make it worse are pasta, bread, and dairy. Nothing you really do has helped. And you've also been experiencing a rash over your elbows for the last 2 to 3 weeks. Would you say that sounds about right?
It's a really good summary.
Okay. I'm just going to go through and see if there's anything else that maybe you didn't think of to tell me. How has your energy level been?
I've been kind of just tired.
Okay.
Yeah.
Just overall not, just kind of feeling
Just
fatigued.
blah. Yeah.
Okay. Any changes in your vision?
Nope.
Okay. What about your hearing?
What?
Any changes in your hearing?
No.
Okay. Any sores in your mouth?
You know what? Now that you mention it, when this rash started, I did start getting some little sores in my mouth.
Okay. And how long has that been going on?
Same, about 2-3 weeks.
Okay. Are they painful?
A little bit.
Okay. All right. Ever had those before?
No.
Okay. Any trouble chewing, pain in
A
your
little bit
teeth?
because of the sores, but no, my teeth are fine.
How about swallowing? Any
Fine.
trouble or pain
No.
swallowing? Okay. Noticed any enlargement or lumps, enlargement of your lymph nodes or lumps or bumps up here in your neck at all?
No.
Okay. Any trouble breathing?
Nope.
Cough?
Nope.
Okay. Any chest pain?
No.
Okay. Any weakness
No.
in your muscles, joints, pain in
I mean,
your
just
joints?
being overall tired, but no.
Okay. All right. No pain in your stomach, you said?
No.
Okay. Any burning when you urinate?
No.
Okay. No blood in your urine?
No.
Okay. No dizziness?
Nope.
Okay. All right. Any numbness or tingling anywhere?
No.
Okay. And other than the rash on your elbows, otherwise no rashes anywhere else?
That's right.
Okay. Well, I think that I have a pretty good summary of what's going on here today, and what I'd like to do is step out and kind of gather my thoughts, come up with a plan, and then I'll be back to talk to you then. Okay.
Thanks, Lindsay. You're
Okay,
the
sure.
nicest PA I've ever met.
Oh, thank you so much.
Mhm.
Have a great day.
You too.
Professor Moini?
Oh, yes. Hi, Lindsay.
Yeah, is there any way that you would mind if I presented this patient to you that I just saw? I just wanted to get some feedback and see what you thought.
Absolutely. Have
Okay.
a seat. Let's go through it.
Okay. Sorry, I'm a little nervous.
It's okay.
Okay. So the woman that I just saw, she's a 24-year-old female, and she came in today. Her biggest complaint was weight loss. So she's lost 15 to 20 pounds in the last 3 months, and she said that really over the last few weeks it's really been picking up, which is why she came in today. She's also been experiencing diarrhea in large watery volumes about 10 times a day,
Okay.
which is obviously, as you can imagine, really affecting her life. She's unable to go to work for the last 3 days. She really is targeting bread, pasta, and dairy as the things that have been making it worse, and said that her mother has had the same symptoms previously. And other than that, she really hasn't tried anything. She's not taken any medication. She doesn't feel like there's anything else that makes it better or worse. She has no pain at all, no pain with episodes of diarrhea, no blood in the stool. The stool, she said, is like light brown, not black. She also, interestingly, has this rash over her elbows for the last 2 to 3 weeks, which is really itchy. It's been bothering her. She's been using hydrocortisone cream, which she says hasn't really been helping. Otherwise, she really didn't have too much in the way of complaints otherwise. Those are her big issues. Past medical history, other than having some knee surgery when she was 12, she's had really no medical issues that she could really remember. As far as medication, she has been taking a stool softener for the last few months, which she didn't really think of to stop, so she's still been taking that. She's also taking birth control, which I believe is Elise, she said, and the hydrocortisone cream. As far as social history, she lives by herself with her dog, and she works as a Nabisco taste tester. She has just one drink a week. She did attribute that maybe the Nabisco taste testing is making her symptoms worse, which is why she hasn't gone to work. No smoking. She does not use any drugs. For her nutrition history, she eats 4 to 5 meals a day, says she eats a high fiber diet. She does eat meat. She exercises 2 hours a day. She lifts weights. She does endurance training. She's in pretty good shape. As far as her sexual history, she has had one partner and they do use protection. She's also on birth control. Her family history, her mother has these similar symptoms, and she's just eliminated wheat and dairy from her diet and said that she's never really been diagnosed with any particular condition, but her symptoms have improved with that. Her brother has autism, her father has hypertension, no family history of diabetes, no family history of cardiac disease, hyperlipidemia, cancer. Her review of systems, so I didn't really find anything additional on the review of systems except for a few things, which I'll tell you the pertinent positives. One, she said she's definitely fatigued. 2, she's had mouth ulcers about the same time that she's had the rash on her elbows. Otherwise, she didn't really complain about being dizzy, didn't really have any other symptoms that were concerning to me. I'm trying to think, there's no joint pain. No rash otherwise on her body, no dysuria. So overall, my assessment is that this 24-year-old woman who came in with a 15 to 20 pound weight loss over the last 3 months and significant diarrhea, and my differential diagnosis, I'm pretty concerned given her symptoms are attributed to wheat and dairy that she may have an intolerance to either gluten or lactose. So my plan for that would be to check her antibodies in her serum and ask her to do an elimination diet where she eliminates those foods for the next couple weeks and then come back and see how she's doing. For the rash, I think that it is probably all part of her immune response, and I would increase her to a stronger steroid cream since that doesn't really seem to be helping. Otherwise, for the diarrhea, I'd prefer to not start anything to slow the diarrhea down other than just changing the diet and go from there.
Okay, that was a very good presentation, Student Kozicz. I have a couple questions for you, however. Did you happen to notice if your patient was having this diarrhea because of something that she was eating?
Yeah.
Okay, so what kind of foods made it?
She said wheat, like pasta,
Okay.
bread, and dairy.
Okay, and you said she was a non-smoker.
Yes.
Did you ask her about tobacco use in general?
Oh no, I totally forgot about
So
like,
just
chewing
make sure
tobacco.
potentially chewing tobacco.
Okay, let me just jot that down to remind myself for next time.
On your differential, is infection part of that as well?
Oh yeah, that should have been on there. I forgot to ask her if she has had any trips or traveling, any drinking from water sources. I totally forgot. I'm gonna go back. I'll ask her those
Great.
things.
And then maybe in her review of systems, touch on some infectious. What would be some things you'd be concerned about in her review of systems?
Well, I did ask her about swollen lymph nodes.
Okay.
But I did forget to ask her about a fever.
Excellent. And then do you
Okay.
want to add anything to your assessment and plan if you're looking down the road of potentially infectious causes?
I'd like to get a stool culture, maybe check a C. diff
Okay.
too, since now there's community acquired cases of that, so that would probably be a good thing. So I'll add that as well.
Did you happen to ask her what allergies she had?
I did ask her what allergies she had. Sorry, I forgot to mention that. So she has an allergy to a Z-Pak, which she just said it makes her stomach upset. So, I'm
So
not
more
sure
of an
it's
intolerance.
true
Do
allergy.
you know if she recently just stopped using a Z-Pak?
She didn't mention that,
Okay.
but I actually didn't ask that either specifically.
Okay,
Okay. So I will go back and ask her those things.
excellent.
Was there anything that you felt like I could do better in my presentation?
I mean, I think it was very concise and clear. I think just those few things to get from your patient so that you're making sure to not just be focused on the one differential that clearly it does seem like this patient maybe has some type of gluten sensitivity, but they could potentially also have some type of infection or some other reason.
Yeah, I wouldn't want to miss that.
So you don't
either.
want to just, focus on one thing and discount all other things. But otherwise, I think you did a really great job. When do you want to follow up with her?
Well, I'm gonna go back and talk to her now, just because I told her I'd like finish up with you and then let her know what the plan is. So I'll go back, ask her those few questions, and then put in the orders for what we want to
And
order.
then you can examine, do her physical exam, and then
Right,
go ahead
yeah.
and move on.
And then I think we should probably see her in like 1 week after she's done the elimination diet, if she sticks to it, and see how her symptoms are doing.
Fantastic.
Okay.
Very good.
Okay, thanks.
Good job. Keep up the good work.
Thank you.
Yeah.